Hi, my name is Denise Montes, and this is my Central Line dressing change kit. I am in my uniform. I have nothing, no bracelets, no long sleeves, no rings, no nail polish, nails manicured, no gel. I have my badge. Today I'm doing a Central Line dressing kit change. This is important because we have to change the dressing every 72 hours or per facility protocol. Today I would be introducing myself to the patient, introducing the procedure that we're going to be doing today. I would gather my supplies, but before that I would check the doctor's order, gather my supplies, and then go into the room, identify my patient, ask if there's any allergies, assess the site, and then perform my procedure. So for the purpose of this video, you cannot see my face, but you can see that I am sitting because I have limited space to where I can perform this skill, but my arms will not be moving below here. I have my supplies. I have my mannequin with my PICC line. I have my clean gloves, my trash bag, my hand sanitizer, my kit, and my pen. At this point, I would come into the room, I would knock, introduce myself. Hi, I'm Denise, I'm your nurse today. Can you verify your name and date of birth? Mr. John says his name and date of birth. I confirm with his wristband. And then I ask him if he has any allergies. He replies no. We have already provided safety checks in the rooms. The curtain is closed. Privacy has been provided already. I am going to sanitize my hands. Okay, Mr. John, today we're going to do a dressing change on your PICC line. So you had this done previously? Yes, you have. Okay, so this should be pretty similar. Nothing too different. So I'm going to change the dressing. This is a sterile procedure. So once I open my kit, I'm going to give you a mask, and I'm going to wear a mask as well. Just for this air of caution, and just to be safe, I'm going to have you turn your head to the side. We have provided your TV over there if you want to take a look, and it'll be more relaxing. So do you have any questions for me? No? Again, here I am protecting ergonomics, the safety for myself and the patient. I am level with my working area. The patient is comfortable. And before I begin, I want to put my gloves on and take off the dressing. I want to place a mask on myself, and then one on the patient before I remove the dressing. Before I remove the dressing, I want to place this on him. Oops, it's upside down. I want to place the mask on him. At this time, I can reach over and everything since the cath is dressed. The masks do come in the kit, but you want to do this before to prevent speaking and talking over the area once it's exposed. You don't want the patient to be speaking and it be exposed, and then there could be AC particulates in the air. You want to keep that covered as best as you can. So then I would move on and put on my gloves. So I'm going to go ahead and begin. So I am going to don my clean gloves. I am going to remove the bandage that is currently on. I want to make sure the catheter is intact. Anything that is hanging, I want it distally from the patient and the area I'm going to be working on. We don't want to introduce any new bacteria to the site. We want to make sure everything stays as sterile as possible. Okay, so I'm going to hold down to make sure I'm not moving the catheter. So I'm going to lift the borders of the dressing by maintaining the catheter in its place so I won't move. It won't move. So I'm going to take that off. I'm going to dispose of that in my trash. And then I'm going to assess the area. I see that the catheter is intact. I want to measure where it's at just in case if by any chance it gets moved or pulled. I want to document that in my in my findings. So I want to look at the area, make sure there's no redness, there's no exudate, there's no signs of infection. That's what we want to do. So everything looks good. I don't want to touch it because my gloves are not sterile. So I'm going to go ahead and remove my gloves. Throw those in the garbage. I'm going to re-sanitize my hands. Into my area. So I just want to show this for the purpose of the video. Okay, I'm going to grab my central line dressing kit. I'm going to move it towards me. I'm going to open it carefully away from me, just touching the borders. I want to make sure it stays open, so I'm going to pinch the ends, move it a little bit forward, and here I'm. So now I want to re-sanitize my hands one more time, because now I'm going to be touching the components of the kit, and from here on out I need to be sterile. I need to maintain my hands at this level, not falling below, not cross-contaminating, crossing over my area in either side, either the catheter or my kit. So right now I'm going to grab just by the border, my sterile gloves. I'm going to open it, set it down. I have a 1-inch border that I can work with. So I'm going to open it carefully. I'm going to begin with my non-dominant hand. So I'm going to go ahead with my dominant hand. I'm going to grab my gloves and perform this. No need to rush. We want to make sure we stay sterile. Make sure we get every finger where it needs to be. As I'm stuck. My pinky's stuck. But I want to grab the edge and pull. And then I'm going to grab the bottom, the other glove with the cuff underneath, and then do the same. And then pull. At this point, I am sterile, and now I can touch my glove and adjust my pinky that is stuck. Just make sure you're not touching the inside. You can touch above the glove. Make sure everything is on, okay? So now I'm sterile. I'm going to grab my gauze to grab the catheter. Make sure not to pull or move it too much. I am going to grab my chlorhexidine swab. It's really important to ask if the patient is allergic, because these do come in a kit, and for me, I'm allergic to iodine, so I need to I need to use chlorhexidine. I cannot use iodine. So it's really important to ask for allergies. I asked earlier, my patient didn't have any allergies, so we're okay to go. I would pop this, and you'll hear a clicking sound like breaking a glow stick. So you click, and then you'd wait for the moisture to come down and then saturate the pad. So you're gonna grab this, pop it, and we're gonna wait here 5 seconds, maybe 6, maybe 8, and wait till it's saturated. So now what I'm going to do with my dominant hand and my non-dominant hand holding the catheter, again, I'm not going over my sterile area, I'm going to clean 30 seconds. So the important thing here is to go in a back and forth motion. Back and forth motion around the whole area where you're gonna put the Tegaderm. Up and down, and then all around. You wanna clean everything, make sure everything is clean. And again, this time we're gonna count. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. Now, if your kit has 2, you would dispose of this one into the trash and then use another one to clean the piping or the tubing of the catheter. Unfortunately, my kit only has 1, so I'm going to begin by cleaning the bottom. And it's okay if you by chance touch your sponge to the skin, this area has already been cleansed. The important thing is that you not just moisten the areas to be cleaned, it needs friction. So the friction is what causes this to work, to kill bacteria. And then we're going to do the same thing for the top. And we're going to clean it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 17, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. I am just doing that just to be safe or to be on the safe side of caution. I cleaned my area. I cleaned bottom and top for 30 seconds. Now I'm going to dispose of this into my trash. I'm going to let it air dry for at least 30 seconds. So 1, 2, 3, or until the area is dry. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So I'm going to drop this now. Garbage. And then I can set the catheter down now because the area is clean. The tubing's clean. My skin is clean. My patient is comfortable. Are you having any problems, any concerns? So at this point, I am okay. Again, I did touch the catheter, but I had the gauze, so my hands are still considered clean. So I'm going to go ahead and grab my Tegaderm. I am going to remove the backing. I could toss that in my trash. I'm going to place it on my site. So I want to make sure that the site is completely covered. I want to remove any excess air bubbles that could possibly form. I'm going to remove my tape. I'm going to remove the border. Throw that in the trash. And this does have like a little paper label that I'm going to place on here. Now I'm going to grab my pen and I'm going to write my initials, DLM, and the date is, today is the 23rd, so 11/23/24. I'm going to dispose of my my pen. I'm going to remove my gloves, put them in the garbage. I'm going to clean up my area. And then I'm going to sanitize my hands. Mr. John, are you okay? Any pain, any sensitivity, any concerns for me? He replies, no at this time. Again, I will provide safety for my patient. I will remove his mask. No, I will remove my mask. Then I'll remove his mask. Sanitize one more time. Okay, Mr. John, we are complete. We are done. I'm going to lower your bed. And then I'm gonna put the side rails up just for safety. I'm gonna give you your remote, your call bell, everything's here. You let me know if anything is needed, if you need some pain medications, and then I'll see you when I come back to give you your medications. I'm going to move my camera a little closer so you can see my area. Excuse me, sorry. You can see my area, that it's completely sealed, blocked off. If I needed to, repair request, I could tape this out here so the patient, it won't bother him dangling to the bottom, but it has my initials and the date that the catheter was changed. Again, this is only good. The dressing changes are every 72 hours. And the procedure needs to be completely sterile to avoid introducing any bacteria into the site. That is my video. I think I did everything, and I want to thank you for your time, and please excuse me covering the camera. I had a very limited space and I had to do it here. Okay, thank you.